Which of the following conditions is most likely responsible for this patient's symptoms? Okay. 50-year-old female with current sinusitis presents with shortness of breath, cough, and hemoptysis. On auscultation, crackles are heard bilaterally in lung bases. A chest radiograph reveals multiple nodular opacities. Labs show elevated creatinine and positive C-ANCA. Renal biopsy is performed and histopathological reveals crescent glomerulonephritis. Okay. So C-ANCA, I usually think of Wagner's, the sinusitis, the hemoptysis, crescent glomerulonephritis. Am I not? That's something. I can see it in the pathoma, like he even outlined it. He's like, this is this one.
So you got the diagnosis. Now you got to match your answer with your diagnosis.
Okay. So C-ANCA is like, there's C-ANCA and there's P-ANCA. I know that C-ANCA is Wagner's. Wagner's is granulomatosis with polyangiitis, I'm pretty sure. Good Pastures is something's with crescent, something is with it, and I know it's on here. I can't double check. And then the eosinophilic granulomatous, I'm pretty sure that is P-ANCA, and same with microscopic, I'm pretty sure is P-ANCA. So I think C-ANCA, there's like some weird mnemonic, like it's a stupid one. It's like water closet, like WC. I don't know why, but I remember that.
Okay.
So I would go with that. Yeah. These really
Good.
these
Yeah.
two ladies talking.
This is Wegener's, right? So you have kind of nasopharyngeal symptoms, right? You can have lung symptoms, right? Which is why you're coughing up blood, and then you're peeing out blood too.
Okay.
Wegener's with is positive for C-ANCA, right? You can have crescent glomerulonephritis, right? Which is pretty rapidly progressing. Good Pastures, right? This is going to be, anti-glomerular basement membrane, rapidly progressing glomerulonephritis, and you can have pulmonary hemorrhage. Not really with sinusitis though. That's going to be
not the C-ANCA thing threw it off too. So and then it's also going to be like that's the one that's linear on immunofluorescence.
Yes.
They asked that a lot.
Yes.
And it's usually like a man, like 30s, 40s, I believe.
Eosinophilic granulomatous with polyangiitis, which is Church-Strauss, right? That's IgE related usually, right? Asthma, eosinophilia, right? Microscopic polyangiitis, P-ANCA, also like you said, it's small vessels, lungs and kidneys, but not usually sinusitis. SLE, okay. Lupus has a bunch of stuff. I always
lupus can tie into so many things. It's always on there.
It's almost every, hematologic, right? Lungs, kidneys, right? Skin, right? So just kind of, I always say lupus is, every time you learn about lupus, add another thing to lupus, right? There's double strand, DNA, right?
Antihistone. There's so many. There's the drugs. There's like drug induced. Okay.
Yep. So, you want to kind of learn those things because they can ask it anyway, right? Sometimes you can have lupus without the malar rash, right? And so you want to learn all those things. So,
okay.